MSF is working towards the eradication of Yaws in the north of Congo. Yaws is a disease that affects the skin and bones. It's treated with an antibiotic called azithromycin. To totally eradicate the disease, we need to know which villages and settlements are most affected and to treat those inhabitants.
The whole idea of this campaign started in the very beginning when the MSF team here in Betu noticed that they were treating a large number of cases of Yaws, generally in their mobile clinics, not here in Betu itself, but in the periphery, and that all of the cases were among the autochthonous population.
The campaign severely tested the MSF teams. For 2 months they travelled on foot or in dugout canoes through the heart of the tropical forest in northeast Congo in order to reach the Aka pygmies. Ostracised in its own country and living scattered across the forest, the community has no access to health care.
Nous sommes ici pour pratiquer une campagne d'éradication du pian.
We are here to conduct a campaign to eradicate Yaws. Yaws is a bacterial infection that affects mainly under 15-year-olds, which causes acute skin lesions and attacks the bones.
Et osseux, très grave.
Few people have even heard of Yaws. A neglected disease, it persists only in isolated populations in intertropical areas. While we have come a long way since the ravages of the 1950s, the devastation it continues to wreak is still all too real. During the first stage of the campaign in September, 3 teams set off to the villages to treat close to 20,000 people, their strategy being to treat the whole population, as anybody can be a carrier of the disease without showing any symptoms.
Comme vous savez, aujourd'hui on fait un traitement contre la maladie du pion. Et je pense que c'est possible que chacun de vos enfants ait le pion.
On a un moyen simple de la traiter et de l'éradiquer.
We have a simple way of treating and eradicating the disease, a single dose of azithromycin. It's an antibiotic which has been around for a long time. It is highly effective and well tolerated. It is safe and can eradicate the disease in a population that the health services usually find difficult to reach.
Chez une population qui est difficilement accessible d'habitude par les différents services de santé.
During the second stage, in October, the teams went back to the villages to make sure that everybody had been treated and to assess the efficacy of the treatment. In all, close to 17,500 people were treated, but MSF still needs to return to the areas at risk in 6 months' time to treat those who have yet to be seen.
After this campaign, we'll be willing to share with all sorts of partners around the world these experiences. If we share this, what we've done, how we've done it, with a wide audience, that we can both be useful to the people who will continue, but also maybe inspire others to do similar projects, similar campaigns in other regions.
More campaigns are essential if the World Health Organization's objective to eradicate Yaws by 2020 is to be met. The data collected in the epidemiological study conducted by Epicentre will be shared with the Congolese authorities, the WHO and all the different stakeholders involved in eradicating the disease.